highlights?
The biggest highlight, I think it was taking over. I got an opportunity to take over the Deputy Development Director, British High Commissioner. Just hearing the British High Commissioner, I was so excited because I don't know, I just felt like, hey, this is such a big position. Just being chosen and told that, you're going to take over this role. So in that role, what happened is I was the Deputy Development Director for a day.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases. And sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Greetings and welcome to another episode of the African NCD Champions podcast. On this podcast, we meet and talk with young people, old people, and influential people working in the non-communicable diseases space across Africa, and we are hoping they share with us their insights, stories, and life experiences. Today, we are going to be talking about the Young Health Program, and we're going to be talking to the actual participants who are implementing activities during this program. The Young Health Program is a program by Plan International that is being funded by AstraZeneca that focuses on improving the state of non-communicable diseases in communities, especially with a focus on young people. As we know, Kenya has high rates of non-communicable diseases, and a lot of the young people are exposed to non-communicable diseases risk factors, which include tobacco use, alcohol use, physical inactivity, unhealthy diets, and air pollution. The Young Health Program also focuses on sexual and reproductive health as a way to improve health in the communities. Without further ado, we'll be talking to our guest who will be bringing insights, knowledge, and her experience as part of a mentorship program which was housed inside the Young Health Program. And without much further ado, give us a quick, maybe not so quick, but give us an introduction to yourself, what you do, and how we got to be here today.
So hi, my name is Monicah Muiruri. I am a peer educator and a counseling psychologist awaiting graduation this year. How I found myself as a peer educator under Young Health Program, I volunteered I used to offer psychosocial support during when we were experiencing floods in Mathare, and so that's how I got an opportunity to volunteer, and then I applied for a role as a peer educator. So that's how I got to become a peer educator.
What motivated you to offer psychosocial support to people during the floods? What was the reason behind that? I mean, you didn't have to do that, so why did you end up doing that?
Because it's my community, and also because I have the skills, I've been trained, and it's also an opportunity just to put the things that I've learned in school into practice.
Yeah, so you started to volunteer, you started to offer free psychosocial services to victims of flood, and then you got into the Young Health Program as a peer educator. So what was your role as a peer educator as part of the Young Health Program?
So as a peer educator, I educate the community based in Mathare, specifically Mathare. The community and school, I conduct school sessions focusing on non-communicable diseases. So we use the 5x5 model by World Health Organization, and so it's teaching the community about tobacco use, alcohol, unhealthy diet, physical inactivity, air pollution, and how these risk factors lead to NCDs, then non-communicable diseases like cancer, cardiovascular diseases, respiratory diseases, among others, because these are things that the risk factors are things that we experience in our community. Yeah.
I see. So you ended up doing this in Mathare for some time, and then you joined a mentorship program.
Yeah.
So talk to us about the experience of how you added to your title as a peer educator to a mentee, and talk to us about this program.
Yeah, so whilst I was a peer educator, I was selected to be one of the girls to be part of the mentorship program. So what happens is you write a bio about yourself, your goals and your visions, and then that's shared with the person who's going to be your mentor. Yeah, so that's how I got selected to be into the mentorship. And for me, this was my first time experiencing mentorship. It was very phenomenal, very eye-opening, and just a great journey when you know there's someone working with you in your journey and leading and supporting you. Yeah.
So we talked earlier, and you mentioned that as part of the mentorship, you had a couple of goals that was shared as part of your bio, and then your mentor helped you work through some of those goals. So what was that experience like? Give us an example or a day in the life of you as a mentee, and how it had a transformational experience helping you to achieve your goals.
Yeah, so maybe I can share the first time I met my mentor. We had an activity that was organized. It was happening in Karura Forest. So that it was like a team building activity for mentees and their mentors. And so that's the first time I ever met my mentor. It was she's a lovely lady. She's called Eva Njoki. Shout out to her. It felt nice, but also for me, because I never had a mentor, I thought it would be the relationship of a student and a teacher, considering that she works for Plan International. I just thought that it will be, she will be telling me the things that I need to do. But I remember that time I was just telling her, these are the things that I want to do. And she told me I would want to know who you are, who is Monicah. And that really intrigued me, because it was this person is interested in knowing and investing and getting to know who I am as a person. And so after that conversation, we planned for a meetup, and we will have meetups, and we will discuss about the things that I foresee for myself, what are my goals, what are some of the things that I struggle with, or what is even just happening in my life. So that's what would happen in a day in the life of a mentee.
I see. Yeah. So it wasn't your typical teacher student and telling you what you're supposed to do. No. Kind of relationship.
Yeah.
That's good to know. I mean, from my expression, it also shows that you are very, when you're just talking about her and the experience, it brings a lot of joy to you.
Yeah, it does.
Which shows what that journey was like. So what did you achieve as a part of this mentorship program?
I should be detailed. One of my goals was to learn about finances. I've never been taught about how to manage finances, and I wanted to learn about even matters to do investments. So my mentor guided me. She's the one who taught me about how you can even save on a money market fund. I never knew about things such as money market funds. And she would encourage me that, when you start saving as a young person, even that 200, that 50 shilling, you deposit that in your money market fund, or if it's an account that you have opened, it just boosts your self-esteem as a person. Yeah, so that's one of the things that I learned. Another thing I learned from my mentor, that it's okay not to know things, because for the goal of investment, she was very honest with me, and she told me for her, she's not in a position, she doesn't feel like she would guide me best on matters to do with investments, but she can refer me to someone. And that to me made me realize, by the way, it's okay not to know things. You don't have to know everything, as I had previously thought that now this is a mentor, she knows everything. She really it really did boost, or it really gave me confidence to know that, by the way, you won't know everything, and it's okay. You will always get other people who can guide you on that. So that was something that I took away from my mentor. And also just believing in yourself, because during our mentorship session, I wasn't the only one sharing my goals. Like, I know some of the things that my mentor shared with me that she would like to achieve, and that just made the whole mentorship feel like we are in this together. Yeah.
Yeah, that's nice to hear how you break it down. And perhaps, what was the biggest highlight of this whole experience as a mentee? What was the one big thing that when you think about your time as a mentee, you're like, this is the thing that was one of the biggest highlights.
The biggest highlight, I think it was taking over. I got an opportunity to take over the Deputy Development Director, British High Commissioner. Just hearing the British High Commissioner, I was so excited because I don't know, I just felt like, hey, this is such a big position. Just being chosen and told that, you're going to take over this role. So in that role, what happened is I was the Deputy Development Director for a day. So whatever that she does as a Deputy Development, her name is Edwarda Mendoza. Shout out to her too. So what happened is we went to that day when you're taking over, you're doing like whatever that's in her schedule, you're working with her and doing whatever that she does. So like for me, we went first to Kianda Level 42 Hospital. It's in Kibera. So there they have like a project that they're funding. DESIP, it's funded by the UK aid. So it's a contraceptive program. Gives contraceptive to girls, and just seeing those girls there, and getting an opportunity to talk to them. And I remember when we were walking through those corridors, there's this lady, the matron, and everyone, it felt like I was being respected, even though I'm a young person. That felt so nice. It felt really great. And also being carried by a Land Cruiser for the first time, back left. It felt so good, so good. It was such an amazing experience. Yeah.
Yeah, and this takeover is, I think, is one of the very brilliant initiatives for how to actually show you that you can actually do that work.
Yeah.
That you are also just as capable as the deputy to take over and run that administrative work itself.
Yes.
Yeah, that's very nice to see. So do you have a photo, for example, that was framed of you on that seat signing things and
I think we have some couple of photos walking into that, like all the activities that we did. I think we have some couple of photos. There's even like a magazine that, what's the name of that? I've forgotten that magazine, but I'm part of that magazine amongst other girls, because Plan International gives opportunities to, girls just to go there and take over and know that you also belong here. You are also capable of being a leader.
Yeah, so as we move towards the concluding parts of this conversation, perhaps now that you've been a mentee, it was your very first time being a mentee, it looks like you had a very nice experience. What advice do you give to other mentees out there?
My advice to other mentees would be to take advantage of that opportunity, because like for me, having a mentor who worked in Plan International, sometimes I think like I would have maybe told my mentor, what are there roles in Plan International that I can get and as a counseling psychologist when you're working, and maybe there's a partnership with other organizations, can you hook me up with them? So taking most advantage of that opportunity that you have and just enjoying the process, because this is a journey between you and your mentor. No one is superior to the other person, so you are all learning at the same time. So that would be my advice to any mentee.
I see, and with that, I thank you very much for coming through and for sharing a little bit of your experience as part of someone who has actually gone through the mentorship program anchored under the Young Health Program. And for those who are watching, thank you very much again for joining us, and we will see you on the next one.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.